So health coverage by harnessing the use of digital technology and data. It's really a privilege to be here today with all of you, together with a fantastic panel that really bring together different perspectives, including regional, global perspectives, as well as multilateral perspectives from the WHO, as well as perspectives from young people. We look forward to discuss the need for additional funding on this panel to support the equitable, inclusive, and sustainable digital transformation of health systems, and really the opportunity that this offers to help achieve and accelerate progress towards universal health coverage. So to set the scene for the session, I am going to invite my colleague Kirsten Mathiasson to present a new report that we launched at the World Health Summit in Berlin a couple of months ago that makes the case for this investment agenda. So Kirsten, over to you.
Thank you. So as Matilda mentioned, Transform Health recently launched a new report entitled Closing the Digital Divide, More and Better Funding for the Digital Transformation of Health, earlier this year, just a couple months ago at the World Health Summit. So the report presents a conceptual framework to guide investment and action towards health for all in the digital age. It provides an evidence-based approach to prioritize investment areas and define the level of investment needed to support the financing of digital health transformation. And I just want to make note of and acknowledge the incredible contributions of a number of partners that really contributed to making the report what it was. So just to mention a few, including the Joop Lang Institute, the Path Digital Square, our regional and youth partners, including AHIN, Rekainsa, Helena, Zimam, and our youth partner, Young Experts Tech for Health, and members of our Global Research Consortium, which represent a number of global, regional, and national stakeholders. So why do we need increased investment in digital health? So Transform Health believes that digital transformation has the potential to expand access to healthcare, to accelerate progress towards achieving universal health coverage by 2030. However, to date, the adoption of digital technologies and data for health has often been siloed and fragmented, and this has resulted, unfortunately, in uneven benefits for different population groups. However, we've reached a stage in the digital transformation where we really need to be thinking beyond individual technology solutions to a more digital transformation of the health system, and really focus on what that whole system digital transformation looks like. So why have we developed this conceptual framework? So a big question remains about what the cost of this digital transformation of the health system looks like. Until now, we've largely been left in the dark about what that costing looks like. There's a lack of data around the costing. So little information about the amount of resources that are required, and also how that funding should be invested and what areas of investment should really be prioritized to support that digital transformation. And also a lot of the investment that is being made by governments and donors and other partners often isn't routinely tracked to be able to understand kind of what levels of investment are being made, as well as what level of investment is needed. And without that information, governments so often struggle then to develop realistic costed strategies or to mobilize the necessary funding to really support that transformation. And often, external investment hasn't then, in the absence of those strategic plans, hasn't necessarily been aligned with national health plans and priorities. And so as the digital transformation of health continues to accelerate, it's critical that investments are not only increased, but also better coordinated, aligned, and directed towards addressing health inequities and building stronger and more resilient health systems. So this is why we've developed this conceptual framework in the report. So in the report, we've identified 9 priority digital health investment areas in 78 low and lower middle income countries over the next 5 years. These 9 investment areas that you can see listed on the slide were identified from inputs from over 350 stakeholders to identify what these priority investment areas are that are needed. And then we modeled, by modeling the estimated cost of these 9 priority investment areas, we've come up with an indicative figure for resource needs for the digital transformation of health, including 5-year cost projections for this. However, just to note, in addition to these 9 priority areas that you see listed, there'll also much more investment will be needed to increase digital connectivity and use among populations, and to strengthen the enabling environment for the digital transformation to ensure that it's equitable, inclusive, and sustainable. So based on this modeling, we estimate that an investment of $12.5 billion is needed over the next 5 years for the 9 priority investment areas, or approximately $2.5 billion per year on average. It's estimated that approximately 3/4 of the total investment needed is for digital connectivity infrastructure within the health sector. And these projected costs represent approximately 1% of annual government health spending. And based on current levels of domestic funding, we estimate that around 60 to 70% of the investment could be funded by national resources, with the remainder supported by external investment. And while this provides an indicative level of investment needs, important to note that true investment that is needed within countries will ultimately determined country by country based on country needs. And just to note that, it's really important that countries are in the leading role in funding their health systems, but in some resource-constrained contexts, it's this external investment that will be important, but it's critical to ensure that that external investment is coordinated and aligned to national priorities. So in addition to estimating the cost of that digital transformation within the report also lays out a number of recommendations for how digital transformation of health should occur. So we include 6 key recommendations, which you can see on the slide. So the first recommendation, we call for more investment from both domestic and international sources to support the digital transformation, really prioritizing to making sure that investment looks at and is focused on the equitable, inclusive, and sustainable digital transformation that's protective of people's interests and rights. And just to note again, while that estimate of the $12.5 billion or $2.5 billion per year, just to say that should really be considered as a baseline, not a ceiling. Second recommendation, we call on international donors and the private sector to ensure that their investments are coordinated and aligned with national priorities to ensure we reduce fragmentation, duplication, and potential waste. Similarly, at national level, all stakeholders should improve that coordination, including, for example, aligning with the principles for donor alignment for digital health. And to enhance transparency and accountability, we call for example, the WHO and multilateral development institutions and donors to work together to develop tools for tracking funding for digital health as part of wider health investments. The third recommendation is for countries to develop or update existing costed digital health strategies and investment roadmaps to lay out the different sources of funding, as well as where there are the gaps in funding and where those priority areas should be for the funding. These strategies must reflect the country's level of digital health maturity to promote interoperable solutions for connectivity, capital investment, data governance, legislation, regulation, literacy, and the workforce. The fourth recommendation is for national governments to establish a robust regulatory framework and policy environment to guide the digital transformation of their health systems, ensuring that it's inclusive, equitable, and sustainable. This needs to lay the foundation in terms of health data use, privacy, digital literacy, and the policies for what kind of digital health systems a country needs to ensure and accelerate progress towards universal health coverage. The fifth recommendation is for mechanisms for meaningful multi-stakeholder engagement in digital health policies and governance frameworks. So really to ensure that digital transformation is effective for improving health outcomes and accelerating UHC progress, it's critical to ensure that the meaningful engagement of civil society, including young people, women, and marginalized communities, to be involved in the different levels of planning, strategy, execution, and monitoring of that transformation. And the sixth and final recommendation is to close the digital divide in digital access, which is really a prerequisite for equitable access to technology-enabled health services. So this means confronting coverage gaps, affordability, digital literacy, and really requires strong political will at all levels and civil society engagement to mobilize policymakers and generate public awareness. If ignored, and the digital connectivity divide continues to widen, it will only widen the equity gap in health access. So this is something that's critical that is addressed as we're looking at the investment in the digital transformation of health systems. So just in summary, so the conceptual framework, which you'll see a few cards lying around the room, so please do pick those up, and there's a code you can scan at the back of it to access the report, as well as other resources. So that conceptual framework, as I mentioned, it not only shows the scale of investment that's required over the next 5 years, but frames really how this investment should be used to steer the better digital transformation of health systems. This is really a critical step in Transform Health's journey to advocate for increased investment in digital health over the coming years, including bringing together the voices of marginalized and disadvantaged communities to the table to ensure that that investment is better coordinated, aligned, and representative of the needs of all populations. And just you can, when you look on the website as well, where you can find the report, we have also developed a number of policy briefs, which you can find there, which have targeted recommendations for different stakeholders that have a critical role to play in the investment of health systems. So there's a targeted brief around the role of national governments, around the role of donors and development partners, as well as the role of private sector in supporting this investment. So I will end there. And just really say we really look forward to the support of many stakeholders, all of you in the room and others, to really support as we advance on this agenda and advocating for increased and better coordinated investment. Thank you.
Thank you, Kirsten. And I'm going to turn to our panel now. We have a really great panel here of stakeholders that were involved and supported heavily the development of the conceptual framework. So I'm going to turn to Nelly first. Nelly, you represent HELINA, the Pan-African Health Informatics Network. I wanted to ask you, what are some of the key trends that you've seen in the region in terms of financing for digital transformation? And maybe you can speak to some of the challenges around funding to support the equitable, inclusive, and sustainable digital transformation of health, as well as some of the opportunities. Thank you.
Thank you. So it's a real honor to be on this panel and to just, relay some of the findings that we found during the study that we undertook together with Transform Health, and some of the observations that we have seen in our work as HELINA. So on the question about key trends, my answer is two-pronged. And one is that there's a trend in the change of funding patterns. So and by this I mean that the sources of funding have changed. And I was very impressed by the conversation that was happening earlier through PEPFAR. And because at the beginning of the 20th, 21st century, around 2000 and 2001, that's when most countries were beginning to their first digital implementation. For instance, that's when Kenya had its first DHIS implementation. And for the next 10 years, investments in digital health and digital transformation were very donor-led and donor-dependent. But in the last couple of years, 10 years, we've seen a lot of involvement from governments. So governments are now investing in digital transformation by in various aspects. For instance, one, coming up with policies that govern digital transformation, coming up with health data governance frameworks, coming up with data privacy and protection laws, e-health bills to just guide this digital transformation. We've also had increased investments from the private sector. So we've seen a lot of investments. For instance, a study showed that in Kenya, just by half of 2022, the total investments raised in seed funding for health startups and startups in the region amount to over $1 billion. And health startups in Kenya account for 20% of the startups in the region. So, I mean, it just shows just how much more, there's a shift in interest. We have more stakeholders gaining interest in digital transformation and working towards just investing in this space. And then the second trend is in the scope of what's being funded. So one of the most exciting one is, increased funding in data analytics. So we have a lot of systems developed, but that generate a lot of data. And for a long time, we've not used this data to actually inform our business processes, inform national planning. But now there's so much interest in funding data analytics to just help us make sense of, the data that we collect in digital transformation. And it's very interesting to find, that now as a person or as a patient, we have so many devices connected to us, your smartwatch, your phone, your tablet, that all generate data that is very specific to you. And there is a new, people are now starting to relate that unique data set that you generate as a person to the genome. They're calling it the dataome. And to just think of what the genome has enabled us to achieve, since we cracked the genome. So it's only, it's mind-blowing to imagine what we can achieve if we can crack the amount of data that we generate. So the investments in data analytics are really impressive. And then there's also a trend in investments towards contingency planning. And this is very, it was very evident after the Ebola outbreak and even the COVID pandemic, because we saw that, the normal way of delivering healthcare was interrupted because our healthcare resources, our health professionals were now focusing on delivering care for COVID patients, and patients who have, chronic illnesses are left behind. But now there's a lot of focus on investments in strengthening health systems, in disease surveillance to ensure that, we are prepared for the next pandemic, for the next emergency, to ensure that, we don't disrupt primary healthcare, that our efforts towards universal health coverage are not disrupted. And finally, the last trend is just how much investments are now shifting from digital transformation that is geared towards treatment and curative solutions towards investments that focus on preventive care and health promotion, because we now realize that it costs so much more to treat a disease than to prevent it. So there are so many investments towards solutions and projects that encourage patients or promote disease prevention. And on the challenges that are there, around investment, one of them I think is really highlighted in this case, and it's the lack of costed roadmaps. Yeah, so we have countries that have roadmaps, yes, but to really figure out, how much will it cost us to, implement this roadmap, and lack of that also makes it hard for people who want to invest in it because they're not sure, how much do we need to put in. And then another issue is the fact that in the places where we have roadmaps and costed roadmaps, they are at the national level. But you realize even through our work, through this work, we realize that even at a country level, going down maybe to down to counties or down to regions, to geographical regions, and even communities, the cases are different. Like, we really need to have, custom-made roadmaps, if I may call it, for communities, because some communities, some regions are 10 steps behind. So we may have a one-size-fits-all roadmap for a country, but if we implement it at that level without going down to the communities to really know if we implement this project, we need to bring real value to these people. What is their real pain point in this community? So we really need to ask ourselves, is this investment that we want to make, does it really address the real issue that this community is facing? And that point reminds me of 2021, which I spent working in Turkana County, which is one of the most marginalized communities in East Africa, and I'm sure represents a lot of communities around the world. So it's a desert county by the literal sense, and it's also a digital desert. And by this I mean, we don't have last mile electricity coverage, we don't have last mile internet connectivity, low literacy levels. People are still very, in their culture. So even telling them to adopt this digital transformation, we will need investments in even changing their mindsets to fund the cultural transformation or the change management. So you see, if we have a roadmap that generalizes Turkana with a place like Nairobi, we will really not achieve what we really need, because we need to address the solutions that, the problems and the context. So we sort of need something like a community, community-centered investment, yeah. And then finally, on the issue of opportunities that are there, I think one is just the increased interest and goodwill from government. Yeah, government, and I think one of the examples that I can give is the Kenyan government, because there's a lot of effort now towards just digital transformation of not just the health sector, but even of the entire country, because we now have a digital economy blueprint. So the government is gearing towards having, an economy that is digital first. And now it goes down to health, because we're also looking towards having a digital first health system. And there's a lot of investments towards policies, towards regulations, towards even strengthening things like data protection, to just build the trust of people, to build the trust of the community in this digital first health system. So that's one of the opportunities that is there. And finally, we have the youth, and I think Shannon will speak more to that, but a very huge population in Africa is comprised of the youth. And the youth are now very, they are very pro-digital, they are very pro-digital interventions, which means we are 60%, our work is 60% easier towards implementing digital solutions, because we already have a population that is welcoming to this, to the digital transformation. So I think that just having the huge youth population is something that we can leverage on towards ensuring that we have digital investments or digital transformations investments that promote and lead us towards achieving universal health coverage.
Thank you, Nelly, and thanks for sharing these reflections with us from the region. I think you bring up some really great points around community engagement and also addressing or bringing in our, youth population, which is going to be so critical. They're the digital natives of this age. I'm going to turn to Derek Monet from WHO. So what do you think is the role, or how do you see the role of WHO to take this agenda forward? And what are some of maybe the challenges and opportunities that you see from a multilateral perspective?
All right, thank you very much. Just to appreciate the richness of the conversation from Nelly, and of course the conversations that will be coming up next from other speakers. We're thankful to be invited to this panel. We've been part of the Transform Health journey that resulted into this report. But also to just thank this panel. I'm very pleased to be sitting in a very highly gender-balanced panel here. Thanks for all the female participants that are on this panel. So really thankful for that. And by the way, we take it for granted in this field, which has historically been male-dominated. Little do we realize that the first, as is taught in computer science, the first female engineer, Ada Lovelace, was actually female. And so congratulations to all the women here. All right, so let's go to the matter at hand. So we are extremely interested as WHO in this conversation around the really increased investments for digital transformation. We're coming from a time where we have seen fragmentation in the past 2 decades. We have also seen lack of coordination. We have also seen, ad hoc funding towards, pilot kinds of projects which start and stop. And so there has been tremendous progress in terms of countries realizing that national strategies are the entry point. There is political will globally, regionally, and outside a few indicators of this. In 2018, the development community came together and ushered in the principles of donor alignment, which also point towards the need to invest in national strategies. The UN Secretary General in 2018 also released the roadmap for digital cooperation, which has a number of aspirations there, including a data strategy that came out recently. WHO in 2018 also, through the member states, was able to receive the mandate to usher in a global digital health strategy. So these are indicators of, this global will around fast-tracking digitalization. The biggest challenge now is really making the case for investments. We recognize that a number of countries have been able to articulate their vision and action plan for their national strategies. The biggest challenge has been the costing of those national strategies. And more often than not, we see countries wanting to compare their national strategies to others, including the costing. And that, of course, has brought in challenges because ministries of finance have required countries to demonstrate the econometrics that went into the costing, and usually it's been really by reference. So this is a cost because that country is the same size as us, or they have the same demographics, and so this is our costing. It's been very hard in this particular case to get ministries of finance or funding agencies to support such strategies because of lack of a proper base. So we're thankful that the Global Strategy on Digital Health has one of the action plans, which is an action towards building a business template, a template to enable countries to actually cost their national strategies. So this report is one of those actions that we recognize contribute towards the actions expected of development partners. We also expect countries to be able to have some methodology of actually costing their national strategies. The road ahead of us is very clear. Next year, we do have a report out to the World Health Assembly to just account for the different actions that have been undertaken on the global strategy for the short term. But at the same time, it is our opportunity to make the case to decision makers to really implement the whole of government approach towards digitalization. So the health sector is not enough alone to drive this transformation, but we need to ensure that the different actors that are contributing to the digital transformation identify that particular stake that they have to address. It could be investment around vital registration that would form the basis of country, patient indexes. It could be the issue of connectivity. So the financing of digital, can be collated by making sure that there is enough coordination in countries so that the different sectors within their budgets are able to contribute towards the national transformation agenda. And that's a fragmentation that we'd like to address through the global strategy, making this national cooperation on the ground. At the global level, we're thankful to the Transform Health Coalition because we recognize that globally, some of the fragmentation that we see in countries is because of vertical funding that goes towards specific initiatives. And so we are really trying to promote with our partners to really think holistically, horizontally than vertically, really applying a systems thinking towards investing in countries, but at the same time, enabling country actors to be able to cost their national strategies to realize why that is important. We're thankful with the partnership we have with USAID. We have been promoting a course for national actors that includes a module on national strategy costing. What are the parameters? What are the indications? And that course has been deployed to all our WHO 6 regions. We continue to want to build case studies so that we're able to ensure that the learnings from that course, especially around costing, are manifested in properly costed national strategies. We will also be building a repository actually revamping a repository of national strategies in the coming year. A number of you might be aware of the previous e-health observatory that we used to run that had different indicators and country profiles, including a repository of national strategies and policies. In the digital space we're in, we are planning to revamp the e-health observatory into a digital health observatory, but at the same time staging a repository of national strategies so that we can learn what is in those strategies. Are they consistent with the fundamental building blocks? Are they costed? And if so, how? And what is the impact? This is the kind of work that WHO is pursuing to ensure that we have strategies that meet the demands of people and at the same time fast track our road towards universal health coverage. Thank you so much. This is my reflections here.
Yeah, thank you so much, Derek, and it's really great to hear some of these next steps and tools that WHO have developed alongside partners to drive this agenda forward, especially at a national level. I'm going to turn to Shannon next from Young Experts Tech for Health. So what are some of the key issues that have been raised by young people in terms of the digital transformation of health systems and financing of this? And what do you think is the key role for young people, and what do you want to see prioritized?
Yeah, thanks. So first of all, it's great to be here representing Young Experts Tech for Health. Yet4H works very closely with Transform Health. Generally, we're very supportive of this investment in digital health transformation. And as Nelly mentioned, that's something that's true of many young people just in general. A huge opportunity is that youth are very comfortable with digital technologies, are very supportive of digital technologies, but a risk that's associated with this opportunity is, that we live in a reality where a lot of young people are more inclined to search for information, including health information, on platforms like TikTok as opposed to Google, which historically has been really a central primary source of that kind of information. And so even now, it can be a challenge to sort of sift through the information that's out there and determine what's valid, what's not, what's trustworthy, what's not. So I think a risk, if we're pushing further into a digital health reality, is that there'll be further exposure to misinformation, further confusion for youth who are trying to make sense of what they find online, which can contribute to the erosion of trust. Another priority or risk consideration that young people think is important in this space is data privacy and keeping consent really central to conversations and sharing and use of personal health data. Thirdly, and importantly, is the general exclusion of youth and other marginalized communities from discussions of digital health transformation and planning. I think that leads into some of the key areas that young people want to see addressed in terms of investment in digital health transformation. Firstly, engagement of youth, but not just youth, other marginalized and historically excluded groups like women, older adults, people living in rural and remote communities, people living with disabilities, are all groups that young people feel it's really important to have as part of a really holistic conversation around what digital health transformation should look like and how it can serve, everyone. What's important as well, as an add-on to that, is the recognition of the fact that these groups are really heterogeneous, and what one representative feels is important from any of those listed groups might not be representative of what everyone feels is important. And so how can we address that, and how can we ensure that diverse voices are included and that inclusion is not tokenistic? What's important as well in terms of something that should be baked into this process is capacity building around digital and media literacy for young people so that involvement in this space is accessible and manageable. And then finally, I think addressing some of the wider access issues that young people face. So how can we make sure that as we're moving towards digital health transformation, some of the wider issues around access to quality information and services in sexual and reproductive health, mental health, areas that have been, gaps more broadly, can be centered as we forge into this digital first future.
Thanks, Nelly, Shanna, for addressing some of those concerns. And, you know, we're very committed at Transform Health to continue working with young people in not just the design and implementation, but also in the governance of some of these issues. So really excited about that. I'm going to turn next to Laurie from PATH. So, Laurie, what do you think is the role of global stakeholders, and, you know, what do you think global stakeholders play in supporting increased investment? And how can international NGOs like PATH support coordinated investment, including working with donors and other partners to realize some of these challenges that we currently see?
Yeah. Well, thanks, Matilda and Transform Health for putting together this really important report. We were really proud to be a key partner with everyone else on putting this together and really raising this issue and bringing us here together today. Such a great panel to be a part of. I mean, I think this is something that's really, I hear as a theme throughout this week that we do, you know, most, you know, the panels I've been sitting in the plenary right before this is talking about how can we both understand the investment that's needed and then coordinate to really come together as a larger community, not just global community, to really get behind the country's priorities and really understand those. So I think that is the primary role as global stakeholders, is really to really elevate and support each country's priorities as they go through this digital transformation journey. So I think, you know, specifically, one is really making the case. This report is an incredible starting place for that. And I think what we will do is we will continue to learn as we go along. And really, what does it take to do? I like the whole of government approach to digital transformation. The WHO ITU building blocks have proven to be such a key source for really understanding what it takes, and some recent work that we did as PATH and with our partners at Cooper Smith, looking at how those building blocks married with change management and really data use. So it's not just the tech itself, but how can all of those pieces come together to really support what the outcomes we all want to see and really what the vision countries have in being able to serve their populations better. So I think in order to keep making the case, particularly as INGOs, we can play a role of continuing research, helping to generate that evidence and really package and share it and learn what's working, what's not working. That's not always what we like to talk about and share about, but it's actually so valuable for other countries to hear how it's going, as well as the partners and funders to really inform the investments. Because really the question is not just increase any kind of investment, it's the right kind of investment for the different context and situations. So I think we can continue, oops, I shouldn't touch my mic. We can play a very ongoing important role with helping to provide that technical assistance and support wherever countries and other partners need it, but also helping generate tools like Digital Square just launched this week, a total cost of ownership tool that can really help name out, married with the costed investment roadmaps, what does it take and what is it going to need, both for startup and initial implementation, and even more importantly, that ongoing cost of maintenance, refresher trainings, upgrades, replacement of equipment. Those costs are real and really helping governments to plan for and project how they will cover those costs. So I think that's one really important role that we play. Another then is that advocacy role, whether it's formal advocacy or it's just in how we partner with different donors, with other NGOs, and even more importantly with the country governments, and really understanding and what the vision is and really continuing to focus on the priorities and everything that we do. And I think a key part of that is helping, is capturing the learnings to really help set realistic expectations. I think there's often ambitious expectations that we can do, you know, so much in this short amount of time, and I think we're still learning a lot and continuing to pull those learnings together to say this is really what it takes, and this is what we need, you know, what a country needs, and really and giving them that information so they can plan accordingly and pull together what they need to get the job done. And then I say finally, I think, on this theme of coordination, I think this is something that particularly in the NGO, the international NGO sector, we can really help play both a connecting role, because we do have deep partnerships with many country governments, more and more, at least in this path, more than, well over half our staff are in the countries. They're from the countries that are being, that are the partners, and really, are there to be able to be partners to the government where and when and how they need it. But we also have partnerships with the donors and funders and other partners. And so how can we play that, move away from competitive space to connecting space, and really focusing together on how we can support these digital transformation journeys. And then let ourselves be coordinated. As the country and it really, puts together different governance mechanisms or ways that they want to really drive this agenda, then we need to let ourselves be guided and coordinated. And I think that is a shift that we're starting to see. I think we have a long ways to go still, or more ways to go with that. I think that's just something that is a really fundamental shift that we need to all lean in on.
Thanks, Laurie, for sharing some of those reflections. So I'm going to turn to the audience and see if we have any questions for our panelists, any questions on the investment framework, or any questions on what they have brought up here today. Yes, please. We have two here, so maybe we start with the front at you. Yeah.
Thank you so much for according me the opportunity that probably I can comment on this. First of all, I'm Simeon Yosefe. I'm head of digital health in Malawi. I'm particularly happy with the presentation and the direction that you are now taking. But what I would really want to understand is now at global level, how flexible have you become that when you talk of like coordinating, you are not just talking in the way of talking so that people understand that you are talking, but to what extent have you agreed that when it comes to coordinating, you really mean it? Because so many times we hear of, okay, we are talking at global level, we want to coordinate, we want to do this. But when it comes to the countries, each one is doing his own. And to some extent, some like partners would even say, no, we cannot actually pool our resources in this mechanism that you have come up with. How much have you tried to resolve those issues? That's what I would be very much interested to hear from you.
Thank you so much. And maybe we can take one more question.
Thank you very much for those amazing presentations and discussions. My name is Rose Nzioka. I'm the country representative for Palladium in Kenya. I'm also co-chair for GDHF. I'll just follow up to what he has said, or the comment he has made, that I think it's easy for us to talk about coordination, but the doing is the crux of the matter. Mm-hmm. I think we all have to be committed, whether it's the donor community or whether it's the implementing partners, to this coordination. And I think one way of getting committed is to support government coordination structures and making them strong. Because the governments can convene us. You know, they can require it of us that go coordinate yourselves and come back and have a plan that we can all work together. But if we leave it to INGOs, private sector, whoever it is, people have interests. I think it's the last speaker that was saying that it would be important for us to coordinate ourselves. But how do we do so in the presence of interests and in the absence of accountability frameworks?
Yep.
For those that are donors here in this space, one way that you can do that is to come up with accountability frameworks that require your implementing partners to better coordinate themselves. for those that are in government, it's to require the partners you are working with to strengthen your own existing governance structures. I know in Kenya we supported the government to establish an interagency coordinating committee for health information systems. I haven't attended a meeting in the last 3 years. I do not know whether it's still alive. It's important for governments to have the, what can I say, to have the strength to be able to, and the ability and the capacity to be able to hold us all to account. Thank you.
And Rose, you speak my language. I think accountability mechanisms is exactly what we need. But I'm going to turn to the panel maybe to give them an opportunity to answer some of these questions and comments. I don't know, do you want to start there?
Yes, please, if I may start. Yeah, thank you very much, Malawi and also Kenya, for very important, pertinent questions around coordination globally and also in countries. And I think both of you have made questions, but also contributions in your comments. So I think we need to recognize that the matters that you brought to the table are both questions, but also statements. Agreed with Malawi, I think is an interest at the global level to really strengthen coordination. This is really why the UN Secretary General released the roadmap of digital cooperation. And you are right, expressed intentions written down and the reality on the ground, these need to be merged. Totally agreed, walking the talk. And this is the appeal. And part of the advantage of this forum itself is to strengthen that, because by meeting here, we're sort of like coordinating in some sense. There are different convenings that as WHO we are sort of like supporting, such as the Broadband Commission, chaired by UNESCO and ITU. They have released a number of reports. And the UNGIS, together with WSIS, I know of 2 acronyms that are coming out. But there are global commitments that were part of, such as the ones I've cited, the World Summit on the Information Society, which is a yearly coordination mechanism that draws input from different actors. But more importantly, the Global Strategy on Digital Health, I think, is a good entry point, because the objectives there speak toward the coordination that we're calling for. And that's why next year at the World Health Assembly, we'd like to bring all the 3 actors mentioned in the strategy. So the Secretariat, WHO, the member states, and the development partners to sort of like measure the temperature and ensure that we're walking the talk in as far as getting coordinated is concerned. But what Kenya mentioned is also equally important. Right, spot on in terms of strengthening local convenings. We recognize that countries have expressed their intentions in the strategies, but to make sure that the strategies themselves see the light of day or achieve the results, the coordination Kenya was talking about is quite important. Some countries have established steering committees, some have established technical working groups, some have established intersectoral steering committee like Rwanda, where the Minister of ICT and the Minister of Health were able to launch the national strategy jointly. And they form part of the steering committee in assessing the implementation of the strategy. And I've just mentioned one country, but there's several examples. What we'd like to really emphasize is really getting back to the fundamentals. The reason why the National eHealth Toolkit, as Laurie mentioned, has been so instrumental with the 7 building blocks is that it starts off by emphasizing leadership and governance. And that leadership and governance calls for multi-sectoriality, which is basically having this intergovernment agency coordination framework. It usually goes without saying, because it's easy to say coordinate, but normally goes without doing, because there are individuals that have to play their role. And that is why, once again, we're investing in capacity building with USAID to raise the issue around coordination, but at the same time, cognitive capacity to really know what the roles and responsibilities look like across government. And so it's important for us to continue walking the talk, but we have to continue building capacity, raising awareness at all levels, at the strategic level, at the tactical level, at the operational level, on the need of coordination. But at the same time, as Kenya mentioned, we have to really get into these accountability frameworks that countries already have, making sure that the convenings are happening with a robust agenda, with robust M&E framework, so that the tangibility of those convenings can be felt. Because it's one thing to convene, but it's another to convene meaningfully, right? So meaningful engagement is what I'm talking about. So I think the points you've raised are spot on. Global coordination, national coordination, these two go hand in hand, and we all have to work together to make them a reality. Thank you so much.
Laurie?
Yeah, I'll just build on that a little bit more because, yes, excellent comments, and I think exactly the point I'm trying to make as well is that it's that where there are those accountability frameworks and governance mechanisms, and there are many innovative ones that are coming out. I know Malawi, for one, has the Department of Digital Health and looking at how you can work with funders to pool funding. Tanzania, who is speaking at the lunch plenary today, they have their Center for Digital Health. So countries are really putting these mechanisms in place. And really the point I wanted to make earlier is that now the rest of us as global partners, because there are all those interests at play, need to allow ourselves to be coordinated by the country, by those mechanisms, and really, fall in line with that and really be supporters and rather than drivers. And so that's really what I think as more and more that is put in place in countries. This is the shift I think we're all talking a lot about, but now, the rubber is hitting the road in many ways. What is that going to look like, and how can each type of entity bring their strengths, their skill sets to really support that? So as an INGO, we can bring different tools and, TA when and where needed that is driven by the country's vision and interest. So I think that's really, for me, the shift that we are in the midst of and need to continue doing.
I think we have time for one more question, and then I think we need to... Over there.
Yeah, can I talk? Okay, thank you. Gabriel, I'm with Genesis. Thank you for this discussion. I think it's great. I love seeing this roadmap. One thing that I'm worried a bit, we discuss harnessing digital health, and to harness digital health, I think we really have to use the data that we have, and we have so much data. And I see a lot of preaching top-down to the countries, requesting coordination and creating these working groups, etc. But I see that there's still a fault, and this report brings it to light, the coordination between the donors as well. So how do we plan to use data at the donor level to improve coordination? Because I see that as a huge barrier to achieving what we want with this. So interested on that. Thank you.
Great question. Does anyone want to attempt that? Nelly?
Sure. So, I think the issue on data and the value of data is very evident, yeah. And for a long time, we have had a lot of data being generated at both the country level and even, at national levels and even regional levels. We have a lot of data that is being generated. And I think one of the ways we can use this data to, to advance universal health coverage and even to advance the agenda of achieving equitable healthcare is to, to really look at the data and from where it's coming from. And let's say you have data that's coming from a region that's really marginalized, look at that data in that context and, what are the insights that we get from there, and then use that to, to make investments. And I'll give an example. The same case that I used of working in Turkana. So we had, I remember when I entered there, we had drugs. I remember the shelves. So there were drugs for diabetes and hypertension that were on the shelf from the first month that I arrived. And when I was leaving on the 12th month, those drugs were still there. But we were having shortages for drugs, like for things like malaria, which are really endemic there. So just using data, if we leverage the data that was being generated in that county, in that region, to even help plan better, because the malaria is, most of the malaria funding comes from donors. So, and there's also funding from donors for non-communicable diseases. So for a region like that, it makes sense to direct more funding to the problem that is more endemic, which would be malaria, instead of having funding going to hypertension and diabetes, which is not endemic in that region. So really using that data to guide context-specific investments. Yeah.
All right. Yeah.
I'll just add on a couple of comments on that one just quickly. There's a session coming up next. I think that'll be a really great question to ask the donors themselves, because I know that this is something that's being talked a lot about and how they're exploring to do that. I think largely, though, as a larger community, I think we can continue to look at that data and how can we use it to continue to make the investment case, the value proposition in investing in digital and investing in it smartly, and continuing to learn together. What does it take? Where is it working? How do we iterate and really and build on that together? Globally across all our work, and really having that visibility into what it takes and the costs in particular. And I think there's a lot more learning to do there. So I think that's an area where the data play a very important part.
Thank you. So I'm going to ask each of our panelists to just wrap up some of your reflections from the session here for 2 minutes from your various perspectives. So maybe we'll start with Shannon this time.
Yeah, I mean, I don't think I'll take 2 minutes, but just to reiterate, I think a really critical success factor in this work from the perspective of youth is making the process to digital health transformation inclusive, participatory, ensuring that it reflects the voices of youth, but also the voices of the diverse communities that really make up the populations that participate in healthcare. Yet 4-H is really looking forward to continuing to be part of this work, as well as continuing to expand our youth networks to make those voices more diverse.
Lori?
Sure. Yeah, I think I think that's actually such an important comment in thinking about how data are used, and also the process of accountability that we've been talking about how I think this is something for all of us to really focus on is how those voices can be a core part of that process. So I'm very much reflecting on that. I think that's really important. I think the other things I would mention is just the importance of really focusing on, as countries are doing their strategies, they're doing their costed investment roadmaps, really that being the driving factor, and all of us really getting behind that and focusing on it, and then continuing to have some transparency around how it's going and where the investment is most needed, and really the true costs. I think there's a lot more we can learn around the true costs of doing this work. That really is going to take all of our efforts, right? Really coming together and understanding. And that will then help inform the ongoing investment case and what we really need writ large to do this work and to do it well.
Thank you. Derek.
All right, thank you so much. Once again, thanks for inviting us to this panel, and thankful to the different questions and insights from the audience. I think from the WHO's perspective, we're really thankful for the opportunity to be able to deliver on the global strategy on digital health as provided to us by the 194 member states. But at the same time, we're thankful to the coordination from the global community as we see in this room. My personal testimony is very brief. I came into this career about 2 decades ago. Talking about ICTs in health back in the days was very hard because the investments were towards other things. They were towards tangibles, drugs, clinics, hospitals. But we've seen a remarkable shift in the past 2 decades. Decision makers, health workers, all actors in the ecosystem realize the potential of digitalization. Responsible deployment, development, engagement is what is upon us, and really thinking about the people, patient centricity. And that's why the call towards coordination, the call towards investing in digital as we march towards the 2030 agenda is extremely important for us to work together on. The member states are ready, development partners are engaged. The people themselves, because of COVID, have seen the value of digitalization. Telemedicine is a good example. It's been amplified during COVID compared to previous years and times. So we have an ecosystem that is ready for digitalization. And as we heard in a panel I was at in the early hours of today, the people side of things must be addressed, from the health seekers themselves, to the providers, to the people that make decisions on digitalization. We really have to continue investing in people, the workforce itself. And at the same time, it will be critical for us to continue elaborating national strategies that are costed to attract investors and to enable countries themselves to drive the agenda of transformation through the costed roadmaps, the costed strategies, and to really bring to life the principles of donor coordination, the aspirations in the global strategy on digital health, and all these different aspirations that we have together developed. We're thankful for this opportunity and looking forward to use this digitalization to make sure that we improve better health outcomes, and at the same time to make sure that we leave no one behind. Thank you.
Thank you.
Okay, and I'll close off by saying that, from the discussions we've had on this panel and even throughout this forum, it's been clear that to achieve, digital transformation, we need to act together, all actors from the youth, from the global communities, from donors and government, in the different regions and in the different countries. So it's very imperative for us to just continue collaborating in generating these roadmaps, in generating the policies that are going to guide the digital transformation. And finally, to just state that, as we think about the investments we are making or that we intend to make, we need to ask ourselves, and keep our focus on real value, delivering real value to the last person, to that individual in that marginalized community, to that individual in that certain country somewhere. We need to ask ourselves, is this investment going to bring them real value that addresses the real challenge that these people face, and not, challenges that we think as an organization or as an institution that, this is our priority, but does it really impact what those people are facing and the solutions that they're looking towards? Thank you.
Thank you so much. And with that, I'd like to say thank you to our panelists. I'd also like to just share with all of you that from Transform Health, we are in the process now, in order to take the conceptual framework forward, we're developing an advocacy-driven action plan that we hope to work with many of you to develop. And within the coalition itself, we have obviously representation from more than 100 organizations, both at the national, regional, and global level. So we really want to consult within the coalition and with new coalition partners, hopefully, to really bring this agenda forward and really help galvanize the need for investment for digital health transformation to reach our universal health coverage goals. So with that, I thank you to everyone that attended. I would encourage you all to take one of the leaflets that are on the chairs and to reach out to us if you want to have further discussions. Come talk to us here, Kirsten or myself or anyone on the panel, to discuss how you can be involved in this agenda. Thank you so much.